Well, good morning, everybody, and welcome to the Toronto Council on Aging webinar series, thanks to the New Horizons for Seniors program. Today's session is focused on seniors. Let's talk telemedicine. And my name is Kathleen Edwards, and I am a member of the board for the Toronto Council on Aging. And it is my pleasure to introduce you to Lorraine, who is going to be leading us through the session today. So I'm going to hand it over to Lorraine. If you do have any questions, please feel free to type them in the chat, and then I will ask them at the end of the session.
Perfect. Thank you so much, Kathleen. And I wanted to take a moment and just thank the Toronto Council on Aging and the Family Councils of Ontario for inviting me to speak today about something that's important to all of us. We all at some point enter the healthcare system, and to have some tools at the ready for us to make sure that we make the most of that experience is really, really important. So how we help, we are an abrogation company that works for our clients, and we do help them to get through the healthcare system with minimal stress. A lot of families do say that we have given them that peace of mind to give them the strength and the confidence to go forward in the medical system. And talks like this is something that's part of our mission and values. And I really do hope today that you do get something out of it. And there are going to be some references on the website as well for you to download that give you these pointers in a point format, so you can take them with you and use them in your own interactions. Today we've got a few things to cover in the about 45 minutes that we'll be together today. We're going to talk about the importance of communication, and I know we all know that it's important, and certainly when you enter the healthcare system, there is a certain language that we all need to adopt when we're in a certain way of managing ourselves that we need to go forward with in order to get the most out of that experience. So we'll talk a little bit about clear communication. We're going to also talk about relation to long-term care, how to advocate for your loved one in long-term care. And for those of you that have tuned in, you certainly know there's been a lot of things in the news lately, certainly with COVID-19, and the patient ombudsman has come out with a report that I'll touch a little bit on during this presentation on where we can go forward. We'll also learn about preparing for that telemedicine appointment, and you may be the patient yourself, or you may be the loved one of the patient. So giving you some tools to help you get through that. And then lastly, if you end up in hospital or your loved one goes into hospital, how to learn some concrete ways to manage that those days that they're in hospital, so that you get the most out of the experience, and also weaving into that the fact that you may in fact be connecting virtually not only with your loved one in hospital, but also with their medical team. Dr. Philip Hebert is a writer. He's a physician, a bioethicist out of Toronto Sunnybrook Hospital. And I love this quote out of his well-known book called Good Medicine. If you haven't read it, it's quite good. It's an ethics-based book, and he talks about the fact that we all arrive as foreigners in this country of illness. Its flora and fauna, its language and customs are distinctive and challenging, and that patients must voice those concerns openly and honestly in order for the healthcare team to take the best care of them that they can. These are all people that are really, even though they're wearing white coats and they have specialized information, they really are on your side. Realities is very interesting. Back in 2015, the number of people that are above 50 years old or over 64 years old actually surpass those that are under 15. And that changes our whole dynamics in society as far as where our monies need to go from a healthcare perspective, and also how we manage those folks that are in their senior years when it comes to long-term care, when it comes to health care, when it comes to preventative care. And our society is slowly shifting in that way. But again, as either the patient yourself or as a loved one of the patient, it's in your best interest to take that control and to be as knowledgeable as you can going forward. Looking at long-term care in a little bit more detail, this was a report that came out in 2017, and we're drastically behind in the number of long-term care beds that we need in Canada right now. Right now, like as of 2017, there are almost 27,000 people that were waiting for long-term care, and that we're going to need close to 200,000 new long-term care beds in 2035. Having said that, given the recent events of 2019, COVID-19, we do have a lot of thinking to do as a society. How do we want to manage those folks that need to go into long-term care in a safe manner so that it is a very comfortable environment for them and families can feel really good about it. The other thing that's happening also in long-term care is that from long-term care staff, and these are folks that I know personally, that have been employees in the system for well over 10, 15 years. And what they say is that a lot of those folks are in poorer health when they arrive. What that means is more nursing intense care. That means that more PSWs are stretched thinner, and it does become a budgetary issue because we need more staffing in those areas. Staffing is stretched, and that results in a lot of burnout and a lot of transient nursing and PSW staff because it's fairly intense, the work itself. So as a family member, there's a lot you can do to advocate for your loved one in long-term care. And for those of you that might be tuning in from the family councils, like you're playing a huge role in being part of a family council to be able to carry on the wishes of your loved one, to make sure that there's issues that you see that are brought to the appropriate folks, and also that you have that support of other family council members. But there are some concrete things you can do, and I'm sure we could talk for hours about things beyond this one slide that I'm going to show you now. But these are really good concrete things that you can do that will help your loved one have a really good experience and also give you that confidence in their care. Before I go into that, though, this is the report from the Ombudsman, Kathy Fuchs, who was just put in place this past spring. She came out with a report actually last week called Honoring the Voices and Experiences of Long-Term Care Home Residents, Caregivers and Staff During the First Wave of COVID-19 in Ontario. And these 4 recommendations she's making to the provincial government. So I think it bears a moment just to go through them quite quickly. One is that long-term care homes were found to not have a lot of support outside of the home itself. And so if you recall back in the news, a lot of hospitals were partnered with long-term care homes to go in with expert care to provide additional professional or PPE and also professional support and management of the situation. They want to make that a standard of practice so that hospitals are linked with long-term care homes, and that allows for that conversation to go back and forth, and then to have less of a delay in support of those long-term care homes if we have need of it. The second one is visitation changes. And if you recall, again, it was heartbreaking. I would get so many calls from folks saying that they can't get in to see their loved one. What can we do about it? And in order to preserve the integrity of the facility itself, they limited visitors. They said no visitors at all, as you know. And also about communication resources, that there needs to be good communication between patients, families, and the public, so that there isn't this idea that we're not knowing what's going on should something happen, and we are seeing it start to increase in our cases in the area. So communication again is going to be so important. And then lastly, the people that did speak up and the whistleblowers, they wanted to make sure that whistleblower protection is part of what the whole program is aiming towards, so that there aren't repercussions for folks that do say that there are problems. I heard stories in long-term care of staff ordering in their own PPE because they weren't getting enough. All of those kinds of concerns were actually brought to the patient ombudsman, and that report that these recommendations come from is publicly available. If and certainly it's something that could be posted. And if you want to, you can certainly contact me, and I'm happy to send you the link for that. Advocating, though, in general terms for your loved one in long-term care is very practical. Presence is very important. I have, firsthand knowledge, but also knowledge from many of our clients where families are there routinely. They do get seemingly better service. Visiting frequently, try not to be, Tuesday at 4 o'clock, try to switch up the times. When you're there, there's a lot you can do to help with ensuring that your loved one is well cared for. Things like looking at pressure points for ulcers, or just tender spots, whether that be on their bottom, whether that be on hips, on heels of feet, and on their elbows. Checking their demeanor, are they engaged, or are they really bored? Are they sleeping a lot? Are there issues about weight loss where nutrition might be an issue there to bring up with staff? And are there any out towards injuries that you see? Getting involved as part of the family council is, as I said earlier, so important for you, and also making the home accountable through care plan meetings. So if you have issues about your loved one, and to identify what their care plan is and whether or not there need to be changes in that care plan is really important. If there is a problem, being able to follow that chain of command through to the director of care in the residence is important. And again, tact is going to be very essential here, to be able to, in a concrete way, lay out your concerns. As a company, we do help facilitate that, and certainly people will often rely on us for coaching going into those meetings if they feel they want to handle it themselves, but we're their mirror to help them move through that difficult time. There is a forum, as you most likely know, for Ministry of Health and Long-Term Care complaint related to long-term care issues, and the link is here on the slide. And then, for any reason you've got concerns, making sure that you do have follow-up notes, date, time, and place, when the complaint was made, when the concern was raised, and what the resolution was. When it comes to a telemedicine appointment, this is the new normal. Most of us have had some connection with our physician in person. In this past year, there really hasn't been that opportunity in many cases, except for essential visits. I have clients who have had diagnoses of cancer and have had to go into Princess Margaret Hospital on their own because they wouldn't allow family members in there. And that can be very difficult. For doctors, many family doctors are only doing televisits now, but televisits can be very simple. They don't have to be using a computer and a screen like we have here, although that tends to be the trend. It can be a simple phone call. So let me give you an example. I had a client who had a mole that was on their back that they were concerned about. It had done some changing over the summer. They called the doctor's office, and the doctor's office said, well, can you send us a picture? So they had a secure site. The person sent a picture. The physician reviewed the photo. They did have a follow-up phone call, and then the physician from that phone call referred the person to a dermatologist. So it doesn't have to be really fancy, but it does require for us to be prepared. And when it does come to technology, there's some things that we need to consider. So we'll go into that now. The first thing is choosing that technology. If you have a laptop, like what I'm using here, or a tablet, or if you have a standalone computer, or your smartphone, all of those can be used for a telemedicine visit. You want to make sure that whatever piece of equipment you're going to use, that the internet you're using it with is reliable. Going to a Wi-Fi area, like in a store, something like that, probably isn't the best idea, because again, you're not dealing with secure, you're dealing with less reliability, and also you've got the fact that it's not necessarily quiet, it's not private. When you know you're going to do a televisit, there may be some information that you may need to download. There may be a special application that you need to download so that you can access the telemedicine visit. You also should have a telephone number that you can call the office in, that if you have a technical problem and get cut off, you can call the office and get back into the visit with the doctor. And so that's the technology, that's sort of the hardware side of things. When it comes to the preparation, you want to make sure, as I said earlier, you don't want to be in a noisy area where there's a lot of background noise and a lot of distractions. You want to be able to hear what the doctor or specialist has to say, and they want to hear you and see you. If you have some natural light available, like today, for instance, there's a window not too far away from me, and it gives some natural light, that actually helps to be able to see each other a little bit better. And having your phone handy. So I've got my phone here, so if I need to call Kathleen, then I've got that handy as well. And just, you know, having an area that you can be comfortable in. The visit may not be that long, but at least if you're comfortable, you're in your home environment, you're probably a lot more likely to give quality information. The third thing is, and this is before the meeting as well, prepare your medical information. I always say to people, if you're going for a driver's test or writing a test in school, you're going to study, you're going to do a bit of research, you're going to write some notes. And this is what you need to do with a televisit as well. Having a list of your medications is not only something you need to have handy, maybe in your wallet or your purse, but it's something that you need to make sure your doctor's office or a specialist has all ahead of time. If it's a specialist appointment, you may want to include this in any forms that you've been given. Sometimes if it's a pre-op type of telemedicine visit, you may have to provide all this information ahead of time. So things like your family physician, what pharmacy you use, if you have private insurance, and so that needs to be shared with them. And some offices do require a consent for the telemedicine appointment. So again, each office is going to be slightly different, but that's something that you may see. Once you've written your concerns down, share them with somebody. Have someone review them and say, oh, have you remembered this? Make sure that you have that list is easy for you to access, that you have everything in place. And that will be your script. So during the telemedicine visit, you'll be able to talk to those points. The doctor can take their notes and they can dig a little bit deeper and ask some follow-up questions going forward. It's important to keep it very business-like. If you can, think of it like a business meeting, saying these are my concerns, this is what I need dealt with, and keeping it organized will help make the best use of that televisit time. We do, as a navigator, we do help, as I said earlier, with the phone coaching to give you an idea of how to approach things, and also we can be there to give you a sense of maybe things that you've missed going forward into that meeting. And then lastly, during the visit itself, and at the end of the visit, making sure that once you've had all of your concerns listed and you've provided that information, you conducted your business meeting with the doctor, then, you know, understanding what the next steps are. Taking notes during the conversation is really important for you, because you know, we do forget a large portion of what we hear during a medical visit, and if you don't have someone sitting, say, next to you, which is totally appropriate, if you want to have a family member listening on that conversation, you've at least got two eyes and ears to hear and see what the doctor's saying. And you know, in some cases, the doctors may want to do a follow-up visit. They want to do a bit of watchful waiting. But knowing what that plan is and knowing what the follow-up is really important for you. Now we're going to move on just now for 10 tips around your hospital experience. And as I said earlier, right now with COVID-19, I was checking the Toronto area hospitals, and most of them have reverted back to more or less a standard visiting schedule. So the visits occur at Toronto General, for instance, they're from 8 o'clock in the morning to 9 o'clock at night, but essential people only, and a maximum of 4 hours per person. So, that's a little bit tighter than what we've had in years past. But having said that, it's a lot better, certainly, since we had this past spring. So given that this can be a changing environment, I want to make sure that you have some tips that you can count on if you are either the patient in hospital or if you're the caregiver for that person. And again, these references are all available or will be available on the resource area of the website. So the first one is speaking up. And the fact that, if you're a patient and you see the pills that are coming to you in hospital and something looks a little different, it's always good question. It's good to question. It's good to ask what that is. There's a lot of research been done around medical errors and near misses, and the fact that we have about 13% of the time people do experience some sort of either a full medical error or what they call a near miss, where something was wrong but it was caught before it caused some harm to a person. Because that's 13% can be quite significant. So if you are concerned at all about anything, always speak up, because you can be the difference between a medical error or a near miss in your specific case. So speaking up is number 10. Number 9 is being informed. So before you go into hospital or when you're in hospital, either yourself or family members, to do a little bit of searching. If there's information packages related to your condition, many of the hospitals have patient libraries virtually, so you can actually pull down information online. There's a patient library in the hospitals, and they'll actually do searches for you, or you can go online yourself. But you need to be aware that it's kind of like a rabbit hole. It's Dr. Google, and you can go down into a rabbit hole, and before you know it, you're very confused, and you probably have some incorrect information. We do give a talk on how to beware of Dr. Google, but in a nutshell, it's always making sure that you're checking multiple sources and that you do have a lot of backup for that information, and that the information itself is current. Medical information, if it's more than 2 or 3 years old, I start to look at it with suspect, and I would dig a little bit deeper to make sure that information is still current. We do help with research as well prior to an appointment or during a hospital stay if folks are looking for options. Knowing the name of the people that are giving you care is really important. If you're the patient, we always suggest as part of your package going to hospital that you actually take a notebook with you. And that notebook and pen is for you to write down your dates that you're in hospital, what the doctor's names are, what the actual what their role is in your care, and also your what went on. And the good thing about that is that it gives you a chance to write that down, engage with that healthcare provider, and then when your family sees you or talks to you later in the day, you're not having to keep all that information. You're remembering because of your notes. And it's a good idea to have that, and then because one day in hospital floats into the next. If you're the loved one of a person that's actually in a hospital, it's also important for you to have a notebook, because there will be either phone calls you make to the ward to talk to the medical team, or there will be maybe a telemedicine appointment with the doctor. So if you've got those notes, again, it's information you don't have to hold on to. The doctor, can give you information, but you also have your own notes to be able to carry forward your concerns for your loved one. If you're calling the ward, it does say here too, if you're going to have to call the ward on behalf of your loved one, it's a good idea to try and miss those areas of what they call shift change and morning rounds. So if the nurses are on a 12-hour shift, as most of them are, they would have a reporting time between sort of 6:30 and 7 o'clock in the morning, and again in the evening. And that's when one nurse hands off the responsibility for the patient to their colleague that's taking over for the next shift. That's a good time to give them that opportunity to converse with each other. So I don't usually recommend people take that time to call the ward. Midday and after lunch certainly is typically a good time. Or if you are calling the ward, let them know, okay, I know I'm not expecting a call until this afternoon, but this is what's going on. If opening hours open up further, quite often there's morning rounds that occur before 7:30 in the morning, and that's again going around the hospital. If you've got that information that you want to share with the healthcare team, or if you want to connect with someone in the team, that sometimes is also a good time. But visiting hours right now aren't starting until 8 a.m. So if you're there right at 8 o'clock, you still may catch people, but it's a little less likely these days. Knowing how to complain is a bit of an art form in the hospital system. I know there's always that worry that people don't want to rock the boat, but there have been cases, and I've seen cases, and I'll share one with you now where there was a complaint that was needed. Patient relations is sort of the end point for any complaints. But in one case, and this is a fairly recent case that I was involved in, a patient had back surgery. They were using a walker to go in for a shower. The PSW, rather than stay with them because they had just had back surgery, they rolled them into the shower with their walker and left the room. What ended up happening, unfortunately, is the patient had a fall. They had a fall. They did not call the nurse because they were a bit embarrassed. They did manage to get themselves back up to hold on to the walker again. Then the PSW heard the commotion, came in at that point and said, "What happened?" And the person said, "I had a fall." Luckily it didn't cause long-term damage further to the surgery, but we then had to talk to the charge nurse around their process for accompaniment during those kinds of procedures with their patients. So we went through the charge nurse, and ultimately it went through a change in how they managed this particular patient, but they also had to do some re-education with the PSW. So, we were there in order to help navigate through that and take some of the pressure off of the family. When you're in hospital, at the end of a hospital stay, there'll be a discharge summary that will go to your family doctor. That's very basic. You can request results of any of the procedures you've had. So whether it be an operation, biopsy procedures, diagnostic procedures, you can ask for copies of those. Bear in mind the fact, though, that there is information, policies and procedures that hospitals have, and release of information is very closely guarded, really for your protection, because under our legislation, we have to make sure that it goes to the right person. In the cases like this where you have made a request for information, you're not going to get it right away. So it's important to use those notebooks. And when the doctor's giving you information about a test result or about a procedure that's coming up, take notes so you have that to then follow up with when you have the actual documentation. It's good information that you will not only help you now, but it will help you going forward. Those test documents, if you've got a handle on them, whether they be in electronic format or if they're in paper format, starting a file for yourself that you'll have that information that you can take to subsequent appointments. I have clients who have their full medical record on a USB stick that's encrypted, and they go down, I mean, previous years, they would go down to Florida for 3 or 4 months every winter, and they take that with them. They both, it's a husband and wife, and both have been in hospital in the States, and that information has been very good for them. We do offer a health narrative as one of our services, so we'll help you put together that medical information in a format that then you can share with subsequent doctors, and you can take with you, as I say, on vacation or anywhere you go. We are, as a province, moving towards more of an e-chart where we'll be able to, in many hospitals, as you may know, you can access a mind chart application, which is great, providing you can get in and providing maybe a hospital that you're with can get into that. So I'm a firm believer that we have to be our best historian, whether that be in having it on our own USB or being able to have a site that we can upload it to. Knowing the medications and dosing. I'm hoping everyone that's listening today uses only one pharmacy. That's important because your pharmacist is the one that will oversee all of your medications and look for things like inconsistencies, whether or not medications can be discontinued. If you're taking more than 3 medications that are prescription, you're entitled on a yearly basis to a meds check review with your pharmacist. And that's something, it's free, you book it, they review the medication, they actually provide you with a write-up at the end of it with recommendations that you can take back to your doctor. So that's something to think about. If you are seeing, when you do receive a new prescription at the pharmacy and you're seeing a different kind of pill, again, just like speaking up in the hospital, this is a good opportunity to speak up and ask for that clarification before you start taking something. And also too, when it comes to medications, making sure that if you need refills, that you're actually getting the refill from the doctor that prescribed it. Another story that came to my attention recently, there was a lady, a senior, who had heart issues. She was in hospital and she had heart medication that the doctor on discharge, she had a 30-day supply. She took that medication, she got a refill through her family doctor, not through the specialist in the hospital, and took it for another 6 months. But was not required to take it for 6 months. Taking that medication for 6 extra months actually put her in hospital, and it took a long time for her to come back. And she said, why did I ask that? Why did I, just go through my family doctor? I should have gone through the specialist. So that's, for you as an individual, going back to the source, because they have that part of your medical chart available, and they're the ones that are going to be able to take that information and make the best recommendation. Likewise, if you have allergies at all, wearing that medical alert bracelet or necklace, having a note in your wallet. Many of the EMS folk are trained so that they will look in your wallet if they don't see a medical alert, just to make sure that there's nothing that they have to be aware of. And it's very important. So having a list of your medications in your wallet, any allergies listed on that same piece of paper. If you need to wear a medical alert, wearing that medical alert is something that can save your life, because especially if you can't speak for yourself. Being a partner in your plan of care, this all comes down to that communication, being able to understand what's going on, asking questions so that you can be your best advocate, because ultimately you want to be your best advocate. If you don't understand, ask. If it's an issue, again, with COVID-19, a lot of people are finding that, you go into an appointment, you're the only person there. Maybe you're a little hard of hearing, but your doctor now has a mask on and you're trying to understand them and you're having trouble. And I've had this happen recently with patients. And that's difficult. If you have any sort of hearing deficit, masks make it a lot more difficult. So, if you're not understanding what they're saying, ask for clarification, ask them to write it down, ask for written materials so that you can be your best advocate. The next thing is related to your procedures and the fact that when you're in hospital, you are going to be wearing a hospital bracelet. Anybody that comes to give you care, anybody that comes to give you medication, anybody that wants to perform a procedure should be asking you your name and your birthday. And that's a standard of practice across Canada when it comes to accreditation. So that's a minimum standard. Many hospitals now will also have, especially for say cancer care, they will have a face photo of you as well as a third way of identifying you. But make sure that they're asking that. And likewise, if someone is coming to take you to a procedure, ask them their name and where you're going and making sure that you have the information you need to consent to any procedure or to be taken anywhere in the hospital. Number two is regarding PPE. Now, hospitals are, amazing at where they're at when it comes to PPE, making sure that physical distancing is maintained where possible, using the mask and the visors as it shows here. In the hospital for you as patients and loved ones, you wearing your mask, you using those wall hand sanitizers, having a hand sanitizer with you personally, one of those little bottles. And again, as I said earlier, making sure that if you don't understand what's going on, because of the mask and the natural barriers that are now in place, asking questions, taking the time. A recent client that I have, she had to go into hospital for cancer treatment by herself. And the physician was distant away with the mask. And they, in order to navigate because of her hearing issues, they just took some extra time. They took an extra time. They had a whiteboard. They would write things on the whiteboard. She would be able to then respond. They're slowly getting awareness, the hospital system's awareness of accommodating those kinds of issues that people have. Our last point is around being in hospitals, building your advocacy team. So, it's important to know that 90% of the time, the doctor will tell you something, you're going to forget it. And that's really quickly thereafter. That's why having that notebook is so important. That's why having an extra set of eyes and ears is so important. That's why when it comes to the term that we use as health literacy, is the amount of medical information or necessity that we understand as individuals. 88% of people that are over 65 don't understand what their doctor's saying. So being able to have someone with you that can truly support you and you feel supported is really important. We do help with that as well, to be able to be that extra eyes and ears, to take notes during an appointment, to provide a summary for the patient and their family is something that we do, so that it gives families that peace of mind and gives the families and the patient the confidence that they're getting the best care that they need. The other thing too related to this is your advocacy team is not only yourself and your family, it also is, and again, this goes without saying, your medical team, your nurses, your physiotherapists, your doctors, they are advocates for you as well. Having said that, it's very important though that you have the message that you're giving them is true and honest and relentless in order to get the care that you need. So that's about it for me. Did you folks have any questions that I can address right now?
I do have a question, Lorraine. So
Sure.
I know doctors are obviously quite busy, but how can I make sure that I get the most out of the time that I have with that doctor? So if I want them to slow down and repeat something, how can I be successful in getting them to take that time?
For sure. Well, as I said earlier, having that preparation is really important. When we go in with the patient, we go in with, like, I have my list. Usually I have a clipboard that I'll use, and I have everything written down for that patient, and we'll go through it like a very specific business meeting, and with the intention that we have everything is covered by the end of that meeting, but we take the time before we move on to something else, really making sure that you understand. Again, we've got that extra layer of masks that is a real barrier for many people, especially if they're hard of hearing or feeling claustrophobic. Even though the mask will not reduce your oxygen saturation, oxygen in your body, it's disconcerting for many people. So your focus isn't quite there. So taking a breath, asking for repeating clarification, taking those notes as you go. Just the function of taking notes will give you the pause, and it will allow you to think more clearly. And if you're really not understanding, writing those notes will make it very plain to you very quickly that you need to ask a follow-up question.
I have a question tied to, I know some hospitals offer translation services. So how does that kind of come into play? Are they incorporating translators into telemedicine as well, or what's happening?
Well, and again, this is part of the preparation. If you found that you needed a translator, say with University Health Network, for instance, their translators are virtual. So it would be a matter of tying in that translator with a specific visit. It's a request that can be made, and under the policies of the hospital, there's certain times when a translator is required under policy. Generally, when there's a new diagnosis. And when there's a change in the care plan. Those are two times that the hospital will take the lead to say we need a translator for this that's medically trained. In the cases of day-to-day translation, or if someone is seeing a doctor more regularly, they look at the onus of the patient themselves to say, I need that translation. For more mundane sort of information sharing, there can be a reliance on family. But that comes with its own caveat, right? Because families may have their own reasons for not being completely forthright, depending on culture, depending on what the family's dynamics are. But from an interpretation, pure interpretation within the hospital setting, within most hospitals now, they will subscribe to that virtual translator, and that translator would be part of that conversation.
And we have a great question that came in. So someone has asked, do you think that doctors will begin using the masks with clear windows for those who are hard of hearing? Or can you request that the doctor uses that?
I think it's a great invention. And it's actually a Canadian thing. I don't know if you've read the stories on that. There's a company, I think they're in Brampton, and that they started to produce these. I think it's a really great invention for overcoming that barrier. I think what any physician is going to be looking at is whether or not it actually matches the same safety measures as the N95 masks. Because you have to remember that these physicians and nurses and other healthcare providers are not only seeing you, but they're seeing many other people. So they have to think of multiple exposures. And I don't believe that those masks with a clear insert are medical grade. So I don't think there would be a place for them as it is right now. But there would have to be public health and standards for masks would have to be assured that those folks would be safe because they're seeing so many people. I think probably a better alternative to be safe for folks is because this came up with this client that was at Princess Margaret Hospital, that what was suggested is that they convert a consult room to have like an actual screen, that you could actually have a full physical barrier between you and the doctor, which allows for maybe temporary removal of the mask. But again, that has to be all cleared through public health. So I think it's still, it sounds like a really great idea in practice, but when we do try to implement it, we've got to look at the safety of the N95.
Wonderful, thank you. As Lorraine mentioned, she has created a resource that I will be sending to the TCA team to post on the Toronto Council on Aging website. which means, Lorraine, you've done an outstanding job kind of relaying all of the tips that we need to know when it comes to making that transition to communicating effectively with healthcare professionals, especially as we're kind of shifting from more the in-person to virtual due to COVID-19. Who knows how long this is going to continue on, but at least you've armed us with some really good resources and information, and people are now connected with ProHealth Navigators. So again, really use them as a tool to help support you through this uncharted territory that we're now kind of navigating in the healthcare world. So thank you so much, Lorraine, and thank you so much to everyone for joining us for this webinar session today. I hope you enjoy the rest of your day.
Thanks so much, Kathleen, and I hope everyone has a great day. Don't feel free to call us anytime.